All right, I think we are going to get started. Good afternoon, everyone. My name is Shelby Monier, Vice President of Patient Programs and Education here at Zero. And I am so happy to welcome everyone. And thank you for joining us for this very special Facebook Live event today. We're talking about a very exciting topic. So you're in for a real treat to learn the latest and greatest with the PROMISE Registry. We all know, or some of you know, you may know, that prostate cancer may just well be written into some men's genes or DNA. But the exciting information that we're going to talk about today is that these instructions for discovering new treatments and understanding family risk and what it means for you and your family may just be written there as well. So I'm thrilled to have our panelists here with us today. And joining me today, Dr. Heather Cheng, Dr. Channing Paller, lead investigators of the PROMISE Registry. Dr. Paller is Associate Professor of Oncology and Urology at Johns Hopkins University. Sidney Kimmel Comprehensive Cancer Center and Associate Director for Oncology of the Johns Hopkins Clinical Research Network. Dr. Cheng is Associate Professor, Division of Medical Oncology, Department of Medicine at the University of Washington, and she's a faculty member at Fred Hutchinson Cancer Research Center. So thank you both for being here. We are now friends, I feel like. We get to see each other occasionally. So I love that. Thanks again for being here. And I'm also thrilled to introduce everyone to Mr. Clarence Williamson. Clarence is a prostate cancer survivor, advocate, and co-founder of his man-to-man prostate cancer group. He leads Zero's Us2 support group in Memphis, Tennessee, and he is a participant in the PROMISE Registry. So we're thrilled that Clarence is here to provide his perspective. And we know one of the goals of the PROMISE Registry is really to help us better understand how prostate cancer care can be tailored. We hear precision medicine a lot, but tailored precisely and specifically based on a person's unique genetic profile. And this means better information, better testing, more choices, and better health outcomes for people diagnosed with prostate cancer. So with that, I'm excited to get started. Thank you, all three of you, for being here. And let's start with the two doctors that we're lucky enough to have here with us. So really, let's start with, what is a registry? What does that even?
Sure, I can take a first stab at it. Yeah. So this is a great question. So I think as researchers are always really interested in new knowledge and helping to partner with patients to create new knowledge that will help us do better together. And a registry is one type of research investigation or study, as we sometimes call it, or a clinical trial. And a registry study is one where we are really collecting information. So it's not necessarily like sometimes people think of clinical trials. There's other types of clinical trials, which are we're investigating a new drug strategy, and maybe there's a new treatment we're excited about, and then there's a control group which gets the current best standard of care, and we're comparing the two. This is a registry study is really a collection of information and a collection of people's experience, and that's what the PROMISE Registry is we're for people who are interested in provide consent. We are collecting saliva samples in order to test their DNA to determine if they have certain inherited cancer risk genes or gene variants, sometimes called mutations, because we know that those are important, especially right now in the advanced or kind of metastatic disease setting. So really it's learning together, learning for the patient, and then learning about the experience. What treatments did they get? Did they work well? Did they not? So it's really collecting the information and then collecting it for a lot of different patients and then putting that together. I don't know if Dr. Paller has anything to add or to that.
I think that's a great summary of the question of what's a registry. I just want to add that as we were describing that so beautifully, it occurred to me that PROMISE is so much more, because it's creating a community, a place where people with certain mutations can come together and learn from each other and find out more information about drugs and trials and sort of have a community. So that's that's what the title says, but I just was realizing we're so much more. So that was really nice to hear.
Oh, I love that. So let's talk for just a few moments about, I love that community comment. That's it's what we know. And Clarence, I'm sure you can speak for days about this. That's what patients want and need. And that's a true gap in probably most cancers, but certainly in prostate cancer, is that sense of community and knowing other people who are going through the same things that you are. So I love that comment. So talk a little bit more about what it's like to participate once a patient decides to enroll or agrees to participate in the PROMISE study. What's that process like for that patient?
So I'll start with this one. The patient, it was meant to be easy and pandemic friendly. So you can do this by keeping your own physician from your own couch at home. And so a patient will go to prostatecancerpromise.org, sign up, say that they have prostate cancer. That's sort of a requirement. They're over 18. And then they can put down their address and we'll ship them a kit, and they can put down their doctor they want the results sent to. And in a week or so, they'll get a kit or a saliva sample. They'll spit into the kit and they'll ship it back. And anywhere from 2 to 6 weeks later, depending on how many people are signing up at that time, they'll get the results. And what's really wonderful is they get to go over the results with their family and a genetic counselor. And so we really wanted to provide care at a high level to whoever you are, wherever you are, and really support people through this process of genetic testing, because it is complicated. And after that, what happens is if they do have a mutation, they join sort of the longer, we ask them information about how they're doing every 6 months. And we also get their records from their physician every 6 months. And they also get access to learn about new drugs, new trials, and get personal information and webinars about other patients like them with their mutations.
That's wonderful. So it's not just we want you and we want your saliva and we want to know more about you, and then that's all. So it sounds just it's so comprehensive in nature. I love that about the PROMISE Registry. Well, let's spend a few moments. Clarence, I wanna pass it to you. Tell us just a little bit, backing up before PROMISE, just tell us a little bit about your prostate cancer diagnosis. When were you diagnosed? How was it found?
I was diagnosed in 1997. That was my first elevated PSA. You know, I usually was visiting my doctor, my urologist on a regular basis. And in the last time, at the end of 1997, he told me my PSA was elevated. So the next step was a retest. The retest came in early 1998 after I had moved from Chicago to Memphis, and it had increased significantly in about 5 or 6 months. So from there, I went on and got a second opinion. I got a biopsy, and it was verified that I truly had prostate cancer. From then, the usual steps. My wife and I, we discussed it. We were together all the time, and we opted for a prostatectomy. I had surgery. Everything went well for two and a half years, and it slowly began to climb. When they did find it again, it was in the bones. It metastasized, which in the bones is usual. It's a common area. Mm-hmm. So currently, I'm on ADT treatment. It's working well, and my PSAs are like non-detectable. So my example of early diagnosis, that's pretty much what it was, is that I've been, since 1998 surgery, I've got almost 23, 24 years of survivorship. And what I do is now my main goal is to help other prostate cancer patients and their families learn more about this disease, get involved with finding out their family history, and stay up with their medical treatment and their regular exams.
Yeah, that's wonderful. And I think Dr. Cheng, Dr. Paller, this is probably the picture perfect. If someone has to be diagnosed, they're diagnosed in the earliest stages possible, and we're managing the diagnosis as a chronic illness. And so that's wonderful. Clarence, did other members of your family, do you have a family history of prostate cancer?
I've got one member of my family that I know of, an uncle that died from prostate cancer. But like usual, the family stories were kind of cloudy. I always thought he died from colon cancer, but he died from prostate cancer. And cancer is prevalent in my family, not just prostate cancer, but all kinds of cancer. Most of my uncles died from cancer, ironically, different types of cancer.
Okay.
And my dad died from lung cancer. So, and as time went on, I've had nieces, cousins, all dying from some sort of cancer. So cancer is common in my family, and not just prostate cancer.
Right, but it probably helps you to keep an eye out and know how important early detection is.
Yes, it is. And that's one of the reasons I wanted to get involved with PROMISE. My urology visits that I go every 6 months now, in 2016, they did a genetic profile. And it showed I did not have the BRCA gene. But when PROMISE came up, I wanted to put my information in my profile in the registry, so it'd be there and be available for any other prostate cancer down the road, any other prostate patient down the road. So I wanted to be a part of this as soon as I heard about it. And it's part of my mission right now, is to do all I can to help prostate cancer diagnosis and treatment.
Yeah, no, that's wonderful. And I find that we hear that a lot as a motivator for patients wanting to enroll in various clinical trials and research opportunities, that they find a lot of value in feeling like they're giving back to both the patient community and the research community. So that's wonderful. And I know I can speak for a lot of people by just saying thank you for your willingness. So how did you find out about the opportunity to participate in PROMISE?
Okay, it was this year, and I met one of your colleagues, Christine Tran, in DC in January. She was speaking at another prostate cancer event. I go to several prostate cancer events during the year, and what she said really piqued my interest. And we exchanged information and stayed in contact. And within a couple of months, she had arranged where PROMISE came and spoke at my man-to-man prostate cancer support group. So, and then from there, I know some of the men have probably signed up. That's all confidential, but and now, after being involved with the Zero Prostate, I've had the opportunity to be on with these two doctors, Cheng and Paller.
Yeah, absolutely. Well, that's wonderful. I think thank you for also leading our support groups. They're so valuable to the men and participants and caretakers. So thank you for serving in that capacity as well. I have some more questions for you, but I'll pass it back over to our doctors. But we've talked about it a little bit. I think we've skimmed the surface, but to better understand prostate cancer, we have to better understand the genes that are passed down to us. And so this, the genetic information that patients have it's important to help us fight the disease. But let's talk a little bit more about how these genetic factors impact prostate cancer or prostate cancer diagnosis.
Yeah, maybe I'll start and then if that's okay. So I think, one of the things, so Dr. Paller and I are both medical oncologists, and we, at least for myself, a lot of my practice is more skewed towards people with more advanced prostate cancer. Maybe like Clarence, who have had surgery before, radiation before, and then have gone on to continue to need treatment for prostate cancer. We are so fortunate because we have a growing toolbox of new therapies that keeps getting bigger. I call it the toolbox. And hopefully the toolbox, if we do our job right, continues to get bigger with new and more exciting drugs. We just had a new one in the mix called lutetium, or Pluvicto is the other name for it. But what's exciting about the genetics and how it relates to treatment is that for men with advanced prostate cancer, we know that about 10% have certain mutations or variants that they inherit, like BRCA2, which people might recognize from the context of breast and ovarian cancer. And so those individuals have options for new targeted therapies, and some of those are getting used now earlier in earlier disease settings, and meaning we want to try to see if they can be as effective earlier to help people's outcomes. And that there's, clinical trials, and Dr. Paller can talk more about them, but that's part of the sort of goal, is to help men know if they're candidates for those clinical trials, as well as give the information to their relatives if we think it's going to be really important for their management too.
Yeah, I would just add, along the lines of clinical trials, we both have clinical trials open at our sites, and there are clinical trials around the country that are looking for patients. And this is a wonderful way to match them up. And so what are clinical trials? They're really the drugs of the future, right? So one of the trials I have open now is taking a PARP inhibitor targeted for patients with BRCA1 and 2 and other mutations like that. And it's for patients who have had surgery, but then have a rising PSA and need hormone therapy, surgery or radiation. And I have one gentleman who's been on it 3 years and is just doing wonderfully. And he is grateful every time he talks to me, every month, that he does not have to have hormone therapy yet, and that his disease is completely controlled. And we don't know how long this will go on, but this is just sort of a wonderful time that, hey, could this be a future larger trial that gets this drug approved earlier, so that men with prostate cancer, if the PSA starts rising again, it doesn't automatically mean that you have to go on to hormonal therapy. And so it really lets us ask these questions to help patients in the future, for amazing heroes that volunteer for clinical trials.
Yeah, absolutely. So, we talk about the results, but what does it, what's it mean for a patient? And if they, let's say they do return results that indicate mutations in the genes that you're looking at and exploring, what's that mean for their children and their, I think both, if I'm not mistaken, female and male family members? Can we talk a little bit more about those results, what those next steps might look like, maybe what those conversations might look like with the genetic counselors that you're able to equip patients with?
Yeah, it's an excellent question. So most, I will say a lot of the times when people participate, they may not identify a cancer risk mutation. I think, Clarence, that may have been your experience. The testing that we do tests for the currently known genes that we are associated with prostate and other cancers. If somebody is identified to have a variant or mutation that we think is important, and one of the ones we're interested in following, they receive that result with a genetic counselor. And the genetic counselor is somebody who has higher training, specific professional training in how to counsel people about what it means to have a variant, what proactive measures they can do to screen for cancers, for other cancer. Sometimes there's other cancer risk, and then how to communicate with their family members about that, because it can be a little, it certainly is something that's important, to try to convey that information and give relatives an option. Relatives, first degree relatives, meaning if it's somebody's brother or sister, they would have a 50% chance or a 50-50 chance of also sharing that same variant. And they, of course, get to choose whether or not they want to know and what kind of circumstances. Sometimes, there's a better time and there's, a less optimal time to sort of ask those questions. And same thing for children. So there's, I think some further discussions that need to be had with the genetic counselor about sort of testing relatives, and then really making sure that every individual relative feels good or, has all their questions answered and really is making the best decision about when they want to know that. But then if they proceed and are found to have the same risk factor, then there are cancer prevention clinics around the country that can talk with patients, like relatives, for example, about what they can do to screen earlier, for example, for cancer, or reduce their risk through either medications or surgery, and sort of all the different options that might be available. So there's a lot of resources both within the study, and then we really encourage people to share that with their doctors, because we as a research team don't have the same relationship that patients have with their own doctors, right? We want to sort of preserve that and respect that. And they can also have additional discussions with their doctors, and then maybe another genetic counselor that's closer to home. So we really encourage those discussions. They're very valuable. And, we can certainly help connect people if they don't have those resources available, but there's a lot of support built in.
Yeah, that's very exciting and so well-rounded. It feels like the design was just so well thought out. I would love to hear, Clarence, you shared a bit about what motivated you to participate, and then talk more about when you decided, okay, yes, this is something I want to do, is something, a way I want to give back or learn more about my prostate cancer. What was the process like? How was the enrollment process? You received the kit, you had to take the sample. Walk us through that from your perspective.
It was actually, for me, it was very easy. I went online and requested the kit. It came through the mail in a short period of time. Read the instructions and gave them the sample. I gave them the sample, put the sample in the tube, sealed it up, put it back in the container, and dropped it in the mail. And I had my results back in about 3 weeks. And I was glad to see them. And part of the reason I want to do the genetics is, especially initially, is I've got 2 daughters, and I wanted to make sure that I was doing what I could to protect them. So with that accomplished, that's why I wanted to put my profile on PROMISE, so that more work can be done. And I know the BRCA gene is the one that's looked at the most, but I've learned, and the experts, that there's other genes that are being looked at also. So, and I think they're testing for 30 genes, if I'm not mistaken, or something like that. So it was well worth it for me. And I know I'm part of the CDMRP, the Department of Defense. I'm a consumer reviewer. So I do a lot of, every year, this will be my 4th year. So I see the research proposals that come through, and a large number of them are based on genetics and targeting therapies. And I understand that, and I do truly believe that this is the way that cancer will be improving treatments and improving diagnosis in the future. So I really wanted to be a part of that.
Well, Clarence, you have a long list of titles, I think: advocate, research participant, support group leader, research reviewer. I just, I know I already said it, but it's amazing. So thank you for all that you're doing for the prostate cancer community at large. It's a lot, and it's sometimes on a topic that is hard to understand, and sometimes you probably feel like, okay, I'm all done talking about prostate cancer for the day. But thanks so much for letting us get a little glimpse into your life and in your experiences so far. So Clarence, tell me, did you go ahead and speak with the genetic counselor, even though your results were not BRCA positive?
Yes, we spoke not very long. He went over the fact that I was negative for the BRCA genes and explained to me that my profile is in the registry, and that genes are always being looked at, different genes, and that the door is open for us to talk at any time. If I want to contact him, or if something comes up where he needs to contact me, then he has permission to do that. But it was very smooth.
Wonderful.
I just want to thank Clarence, because that's also, we're all individuals. We all have different variants of uncertain significance, minor mutations here and there. And so making a registry to learn more about, is it a good one, a bad one? Is it a medium one? So it's really important. And thank you so much, Clarence, for participating.
I feel blessed to have the opportunity to do this. Yeah.
If I might, I just want to sort of go back to something that you had said earlier, Clarence, and I just think it's important sometimes to reiterate. Our discussion today is really focused a lot on prostate cancer and the PROMISE Registry, which we're really excited about. And but one thing I wanted to emphasize is you had mentioned there are a lot of members of your family with cancer, and that maybe there was and I hear this from my patients sometimes, is that there has been a generational shift where there was, maybe people's parents or their grandparents were not as open about their cancer diagnosis. And so the knowledge of the family history is less well understood. So if people are comfortable, I really encourage them to talk to their relatives and ask and try to find out if there's a family history and understand. Sometimes that's not always known, but it can be very helpful, because even with all we know with the genetics, we also want to make sure we're paying attention to, if there is a strong family history of breast cancer, for example, and we don't find a genetic explanation, it still may mean that somebody might still be thinking about, for example, mammograms early or PSA screening early in, relatives who have prostate cancer. So we are learning a lot, but we know we don't know everything, which is partly why we're doing the study as well.
Yeah, great points, especially about the lack of conversations that tend to happen among family members and their health and their health care. So let's talk. We touched on it, but I just want to really drive home the point about eligibility. So let's talk just a few minutes on who is eligible, who are the people who should be signing up, or who we shouldn't say should be, who we want to encourage to enroll.
I started by saying anybody and everybody.
Right.
And I think that people that who has prostate cancer, a friend of mine tried to sign up the other day, and I'm like, yeah,
just to be supportive, right?
Right, exactly. But the ones that I think forget that we're strongly inviting them and wishing them to join are the ones who got tested with a different provider, right? So who got tested and know they have a BRCA2 or other rare mutation. We really want those people to participate as well, and be willing to provide a saliva sample, because we won't. They know they have a mutation. We want them to join, even though they already have the results and probably have already spoken to a genetic counselor. And so anyone with prostate cancer, it helps if you have a biopsy, but if not, if your PSA was ever over 100, that counts too, and sort of radiographic imaging to show that you have prostate cancer for the people with metastatic disease who never had a biopsy. That's also support. But really, we say anyone with PSA that ever was over 100 or biopsy proven can get tested.
Wonderful. We hear a little bit, I won't say a lot, but certainly some about people being a little bit nervous when it comes to privacy. And I know that the team at PROMISE works very hard to ensure that all data is kept private and confidential. But I would love to hear if you could share some of the privacy and security measures that the PROMISE team takes so seriously, and how that information that's personal is safeguarded.
Yeah, I think it is something that is an important consideration. We do on the study team everything we can. We have to keep the data secure and to keep it confidential, to not be sharing it. Even my own patients that participate, I can't ask for the results unless my own patient sort of releases it to me. So there are a lot of safeguards that have been built into the system to protect patient autonomy, meaning patients' control of their data. It's not, unfortunately, we can't absolutely guarantee it, but we do everything just because, this is, I guess we do everything we can. And I think that to the extent, the same as sort of the medical system, it's as secure as we're able to make it. And it is something we take very, very seriously. We don't share it with everything gets de-identified, meaning your name and any private information gets sort of decoupled whenever we're able to do that. And certainly when we ourselves are looking at the data, I don't see any of the, like I said, I don't know when one of my patients is in the mix, only if the patient told me.
Right. Yeah. Clarence, was that ever a concern of yours, being nervous or concerned about any privacy issues related to participating?
Well, no, it wasn't. I read the literature and read about the privacy, and I just had confidence that it would be okay. And like Dr. Chan said, are there guarantees? Well, yeah, we guarantee as much as we can today. But with the internet the way it is, and all we can do is do the best we can. And I get so much junk mail. People act like they know me, and some of them do have my information. I don't divulge how they can get in, but I didn't have a fear with it because it was more important for me to do it than to be afraid that my information would be out in public. So I wasn't concerned with it.
Yeah. I'm pretty sure I've gotten some robocalls just since we've been on this, having this discussion. So I completely understand. Well, I want to ask, I think, just one or two final questions. I've asked this question of you before, but I'm going to ask it again. How does the genetic test that you provide with the sample that the patient submits to you, how does that differ? I want to say it again and repeat it over and over if we can. How does it differ from the more recreational style genetic tests that are really popular? I think at the holidays to get to see if you can get to know your family a little bit better and your ancestry. So how does what you're doing differ from those more recreational style tests?
Yeah, I think that's actually, I'm so glad you asked that question, because I think it is really, really important. And it's important for patients and really the public to understand or try to glean or get, it is different. They're not the same. Recreational testing is recreational, and those are tests like Ancestry.com and 23andMe, and they're fine if you don't expect them, you're using them in a recreational way. You understand that there's some caveats to the results. And sort of, for example, one of the things is that any clinical test, so the color platform, which is what we use for PROMISE, is a medical test. It's a medical grade genetic test for the 30 genes that are being tested, just as Clarence mentioned. They are when it's a medical test used for medical purposes, there's a higher set of rules or higher quality control built in that are required in order to review it back or to return it back to the patient. And an important thing that I've actually come across for patients who have done, for example, 23andMe, that do say, oh, we report back BRCA1 and BRCA2, but they only report back 3 specific variants out of 1,000 possible ones. So it's really inadequate if you are thinking about your own cancer risk from a medical standpoint or from the standpoint of clinical trials. For example, if you're interested in what Dr. Paller was talking about, PARP inhibitors. So they should be considered very separate and distinct. They aren't the same thing. And I worry a lot when people assume that one, it's sufficient, because it really isn't. If you're not sure, you can call our hotline, the phone line, or email the helpline, or talk to your doctor about whether, what you had was the same thing, because there are some other tests out there, and sometimes it's not really clear to patients, but just ask. So hopefully that answers the question, but definitely recreational tests are separate from what we're talking about for PROMISE.
Yeah, absolutely. And we will drop the URL, prostatecancerpromise.org, into the Facebook comments, so you can keep an eye out for that for those who are listening. So I have one final question. Explain to our listeners how PROMISE is funded and how it's different than most clinical trials and research studies are funded.
Yeah, both of us are involved in many trials, and for me, this is one of the most fun and exciting and least stressful, in the sense that it's funded by a philanthropic organization called Advancing Cancer Treatments. And there's no pharmaceutical companies, there's no companies developing products. So the money was given, and it paid for color tests. And so it is a fee for service. So 5,000 tests have already been paid for. And so this is really great that this is really a community that really wants to advance cancer treatment, like their title says, and sort of provide care for patients, whatever their social, economic, education status around the country.
Well, I said one final question, but I actually have now a final question. And tell our listeners what your goal is. How many patients are you trying to get enrolled, and where are we today?
Our goal is to offer 5,000 men who test on this platform, and to be able to find 500 with variants we're particularly interested in following, like men who may carry BRCA2, BRCA1, genes we're really interested in learning about, PALB2, CHEK2, ATM. So 500 to then do long-term follow-up. So we are, I think, a bit over 1,000. So we've got, and it's going really well. And so thanks to the help of Clarence and other people in the community that are partnering with us. So we really are excited to continue with our momentum.
Yeah, that's very exciting. Well, thank you, Dr. Cheng, Dr. Paller, Clarence, for being here with us this afternoon. Thanks for, Clarence, sharing your story and all that you do for the prostate cancer community at large. And like I said, we will drop that URL, prostatecancerpromise.org, into the chat. And you can visit that website and talk to your doctor. Zero is always a resource for you to learn more about this valuable study. And I hope everyone, all of our listeners, thank you for joining us. I hope you enjoyed this amazing session with these great researchers and amazing patient advocates. So with that, good afternoon, and I hope you enjoy your evening, and thank you.